Good morning, everyone, and welcome to today's webinar on a series on artificial intelligence dedicated to understand more about this very new and exciting topic. I'm really happy to kick off this new series that is supported by the AI Fund. And today, to welcome this new series of webinars, we have two fantastic speakers with us, and we will cover the main topic that is really artificial intelligence in general, for really from science fiction to reality. So what are all our thinking and our ideas based on our knowledge on artificial intelligence and what actually reality is. As an overview, what we're going to talk about in this webinar is a brief introduction to the NEF AI Fund and explain you what it is and why this new initiative is coming to has been given birth. And then we'll talk about an introduction on artificial intelligence. What are the benefits and potential benefits for artificial intelligence for patients? What are the different implications in healthcare? And a little bit of the pro and cons. And obviously leaving the floor to your questions, to really create a little bit of a debate and answer some doubts, some questions, and create some more clarity around this topic. And before dive into presenting you the two speakers and diving into the topic, I just would like to remind you on how to enjoy better at best this webinar. Make sure that you have a strong connection. You can follow this webinar through your tablet, your computer, or your phone. You will be able to receive these slides after the webinar as a PDF format, so don't worry about taking screenshots or taking notes. You will also receive the full recording of this webinar. And to interact with us, if you have any technical issue, you can connect to my colleague Borislava in the chat. And if you have questions, and I really invite you to type your questions while we will be speaking, and we will interview our two speakers in the question box that you are that is available for you in the right side panel. With a little orange arrow. And if typing is difficult for you, is not something that you do easily, you can also during the Q&A time raise your virtual hand and we will be able to give you the floor to ask your question with your voice. Please just make sure if you ask so that you have a microphone at hand that is well connected to the computer. If not, we won't be able to hear you. So enough for the housekeeping rule, and I'm really excited to introduce you our two speakers for today. And the first speaker that we will hear is Frederike Kaltheuner, and she's a tech policy analyst, a researcher, and an advocate for justice in the world made of data. She's also managing the European AI Fund, a philanthropic initiative to strengthen civil society in Europe, which we're going to hear more about in a minute. And the second speaker is Anca Petre. She's a digital health entrepreneur. She's passionate about the impact of emerging technologies in healthcare, and she's also the co-founder of the 23rd Consulting, a Paris-based firm that is known for detecting the latest tech trends in healthcare. Some of you already met her during our previous series on digital health, and for the one that are watching the recording, we will link in the comments. We will link the other series so you can also have a review of the previous webinars. So enough of me speaking. I know you're all excited to learn more about the AI Fund and about artificial intelligence in general. So I would like to invite Frederike to show herself with a camera, if possible. Welcome, Frederike. Thank you so much for being with us today. And we have a few questions for Frederike to introduce the fund. And the first and foremost, a very easy but also a bit complex one is, what is the AI Fund, Frederike? Can you tell us a little bit more about this?
Sure, thank you so much for the invitation. I'm so happy to see that you are organizing this seminar. So the European AI Fund is a philanthropic initiative. It's a pooled fund that's composed of currently 10 different foundations that all put their resources together to really strengthen the voice of civil society in debates around AI in Europe. We started in September. We are currently supporting 24 different organizations. And in our sort of strategy so far, we try to do two things at the same time. So on the one hand, and I can explain a bit more later as to why such a fund exists at all. On the one hand, we're supporting digital rights organizations, tech organizations that have been working on this issue for a very long time. But at the same time, I think this is not just, for us, AI is really an entry point into broader discussions about technology, tech policy, and digital rights more broadly. So all of these topics are increasingly being mainstreamed, which means that no matter what you're working on, you have to now have tech expertise. So if you're an organization that works on the environment, if you work for worker rights, or if you're a patient organization, your work suddenly has to deal with technology. So this is why, in addition to the expert organizations that have been doing this work for decades, we're also supporting domain experts in health, like you, on environmental issues, but we also support organizations that either work with or represent communities that are disproportionately affected by harms.
Excellent, thank you very much. I think we can move on to the next question. And then a bit more specifically, you started to explaining a little bit, but you can elaborate more about why a fund on artificial intelligence dedicated to civil society action and work.
Yeah, I think this is a really good question, and it links closely, I think, also to my personal background. So I worked in the intersection of regulation and technology for the past 10 years. And the experience, I worked on privacy, I worked on sort of tracking, I worked on AI in the past as well, automated decision-making and profiling. And the experience in all of this work has always been that whatever the discussion is, the voice of civil society is grossly underrepresented. And I don't even mean the word civil society, but it's really difficult to find people who genuinely work with the public interest in mind. And I like to compare this to, so I think the next, and the reason why the fund exists is that we see that the next 5 years are going to be really crucial. So regulation isn't the only thing that matters, but at least in Europe, the next 5 years are going to shape the future of technology for the next decades to come. And that's because a lot of very fundamental regulatory decisions are going to be made. And these decisions are, I like to compare them to sort of the ground rules for the digital world around sort of what are rights over data, how and in which context should we use AI, and where is AI not appropriate? What about the market dominance that we're seeing in this market? So these are very fundamental decisions, but at the same time, there's a lot of money involved. Which is not inherently wrong, but it means that there are a lot of vested interests. And so we want to make sure that whatever the rules end up being, that there are strong voices that really work and represent the public interest. And I think the other motivation was the fund launched a bit sooner than initially planned. And the reason for this was that we felt that in the context of the pandemic, this analysis became even more urgent. So in the past sort of 1.5 years, we've seen several trends at the same time. So on the one hand, it's been very difficult for a lot of civil society organizations to do their work because the circumstances were difficult, closed childcare facilities, etc. There are a lot less opportunities to meet and do your usually advocacy work. At the same time, though, this pandemic has really fast-tracked digitization in Europe, which means that while a lot of sectors are struggling, the tech sector is very likely going to emerge ever stronger than before. And that's just meant that, and at the same time, we saw a bit of a reframing at the European level as well. So before the pandemic, the conversation was really about, we need to set the rules straight for the future of technology. And then the narrative quickly changed to, we need technology for economic recovery. And all of this means that we still haven't set the rules that we really need for technology to benefit everyone in the next few years.
So voila, I think that's a very clear explanation of the why, and we're really happy to be part of this initiative. And so a bit of a sneak peek of what you're going to look further down the line, as you're also an expert besides being leading on this specific fund. What is the biggest breakthrough in artificial intelligence in the coming years for you, and how the fund can help civil society to engage with artificial intelligence? Bit of a two questions in one, actually, but you can.
The mean thing by rewording your question and answering a slightly different one. I think the challenge when talking about AI is always that the term itself has become very elusive. So if you talk to computer scientists, they'll be very quick to point out that there is a clear definition. AI is an umbrella term that's used for a set of related technologies. Particularly when we say AI today, we mostly mean machine learning. But what's interesting is that in the public imagination, AI has taken on a meaning of its own. So AI has become a catch-all phrase to describe a wide-ranging set of technologies, most of which sort of apply statistical modeling to find patterns in large data sets and make predictions based on these patterns. But the fact that the term AI has become so elusive, I think, is a real problem, because even though there has been genuine and remarkable progress with some AI techniques in the past decades, and this is mostly for very narrowly defined tasks, such as recognizing objects, where AI is really now able to perform better or at the same level as humans. But the challenge is that this progress in some areas doesn't necessarily translate to progress in other areas. So there's a lot of misunderstanding and misinformation about what AI can do and what AI cannot do. And sort of listening to also these policy debates, I think a real challenge is really differentiating what AI is and what AI is not, and what AI can do and what AI cannot do. There was a study in 2019 that showed 40% of European startups that claim to use AI don't use AI at all. So there's a lot of hype, there's a lot of pseudoscience, there's a lot of snake oils where people say something is AI when it really isn't. So I think for me, sort of, I would like civil society to be really informed and a critical voice that says, in these circumstances, under these conditions, AI is useful for patients, for example, but in these circumstances, it really isn't. And I think we need civil society to make that distinction, because everybody who makes money of this has a vested interest in hyping a technology more than beyond its capacities. And for me, the third issue, which is really interesting, is that sort of, and this is also my experience from having worked on this for the last 10 years on various digital issues, the lesson is always that risks and harms and benefits are very unequally distributed. And that's something to really, really watch out for. So the question is, who really benefits and who bears the burden of risks? And I know we are talking about healthcare, but I think a good example that I always find is all these discussions around policing and AI, like face recognition. And what's so fascinating here is that we've had a lot of conversations about the fact that a lot of face recognition technology has biases in its ability to detect faces and is better to detect the faces of white men than, let's say, a woman of color. But there are broader questions, which is, where in policing is this technology used at all? And the answer to this is, it's used to detect street level crime. It's not used to detect white collar crime, for example, or financial crimes. And I think I like this example because that's the theme. So the question then is, there are real benefits of AI in healthcare, but then also the technology complicates things and there really need to be good safeguards around it. But it's really important to look at sort of who if there are risks, do they affect people equally? So is AI used to just sort of like in context where healthcare is expensive, is it used to reduce costs? Or is it really used to benefit patients? And I think that's a really important discussion, and that's why we're so excited to have you involved as an organization that really has spent so much time working on health and understands what patients need. are.
Thank you so much, Frederike. I think this was very comprehensive, and Frederike will stay with us for the whole webinar. So feel free to ask her several questions. She's also an expert, so she will probably answer to other more technical questions down the line. And you can already type your question in the chat, and we will get back to Frederike during the Q&A time. Now we have our second speaker that I invite on stage, Anca, that I introduced you before. Thank you so much, Anca, for being with us today. And now we're really, after having framed why EPF and why the AI Fund is focusing on artificial intelligence, hoping having motivated our audience that this is really something key to know and know very well, because this will be a big discussion topic in several countries at the European level, and it already is. So let's clarify a bit things, Anca, please. Let's go back to basic. And what do we mean with artificial intelligence?
Well, thank you very much, Elena, for having me for this conference. First of all, before I tell you what I mean by artificial intelligence, let's take a look at what the general public understands when they hear artificial intelligence. And that is pretty much this. Artificial intelligence is linked to, human-like robots that are able to act and think like us. We also have these super smart machines that perform tasks that we humans will never be able to perform. And in other words, it's not very reassuring. When I see these images, I don't like what the future holds for us. But if I tell you this and I show you these images, it's because I have two different news, a good and a bad one. The good news is that this is not what AI is. This is absolutely not how we represent AI. This is how, Hollywood and our imaginary sees AI, but this is not the reality. The bad news is that it will take me quite a while to explain what artificial intelligence is, and it won't be as simple as just showing you a couple of images. But what really AI is, it's much simpler than all these very sophisticated robots. And AI, as Frederike just said, is sort of this umbrella word that holds all these different technologies and techniques that enables machines to mimic human behavior. So when scientists talk about the fact that they are working on artificial intelligence, really what they mean is that they are looking at the way that humans think and act, and they try to reproduce the same patterns with machines. Are they successful in doing so? Not so much today, but at least this is the general idea. And I'll give you a couple of examples. First of all, you use AI, for instance, when you use navigation apps such as Google Maps, because you have an algorithm that uses data such as traffic lights and user-reported incidents and traffic speed, etc., to predict what is the fastest route from point A to point B. And this is a way that you, in your daily life, interact with what we call an AI. Another example is, for instance, when you ask Siri or Alexa a question. These algorithms use what we call natural language processing and speech recognition, which is the fact that they will recognize what you are trying to say with words and then translate that into actions. And the last example is, for instance, Netflix that suggests a movie. Actually, what happens is that you also have this algorithm that looks at what are some of the last movies you've watched, what are some of your, your favorites, and etc. And they are trying to predict again what it is that you would like to see in the future. So these are just very simple examples of how we interact with AI on a daily basis, and it has nothing to do with those very scary Hollywood robots.
Well, that's very reassuring, first and foremost. So when actually we talk about intelligence, so you say that they're trying, scientists are trying to mimic a bit how the human brain works. But what creates the intelligence of artificial intelligence actually?
So I talked about artificial intelligence as being this umbrella word for all the techniques that enable machines to mimic human behavior. But inside of artificial intelligence, we have these different techniques and technologies that maybe you have heard of. Things like machine learning, things like deep learning and neural networks, and all these bizarre words that make no sense in general, but that you hear about all the time. So if we look into them, and I'll explain how they work so that you understand where the intelligence comes from, which is, artificial intelligence, just a little parenthesis, is more of a marketing word than actual artificial intelligence. So keep that in mind. The first thing is machine learning. What do we mean by machine learning? Well, machine learning, it's pretty self-explanatory. It is actually a technique that is very close to the way that we as humans learn. Machine learning pretty much is a way for a machine to learn new skills and then use these skills to a set of data. So if we take, for instance, image recognition, when we as humans see a picture of a rugby ball and a tennis ball, we are immediately capable of differentiating and naming them. We know instantly which one is a rugby ball and which one is a tennis ball. But what our brain actually does to do that is taking into account different parameters. For instance, the shape of the object, the size of the object, even the color of the object. And by combining all this data, our brain is able to identify if we're talking about a rugby ball or a tennis ball. So the same goes with machine learning. What happens is that engineers show an algorithm, a machine, a computer, a bunch of different images. And they ask the algorithm to identify which are the tennis balls and which are the rugby balls. And in addition to that, the engineers also tell the machine that for the machine to identify which one is which, the machine needs to look at the shape, the size, and the color. And based on this data, the machine is able to identify which one is the rugby ball and which one is the tennis ball. So this is what we call machine learning. It's pretty much machine learning how to identify here, for instance, an image based on criteria that are given by engineers and based on a set of data, so images of rugby or tennis balls that are fed into the machine. The problem is that with machine learning, you're quite limited because we as humans, no one has to tell us that in order to differentiate between a rugby and a tennis ball, we need to look at color, shape, etc. We do it by ourselves. And so engineers started thinking, isn't it possible for the machine to identify the criteria by itself without having those criteria given as input? And this is where we land in deep learning. Deep learning is exactly the same thing, except you don't have to give the machine the criteria. The machine just looks at a bunch of pictures and identifies by itself that what differentiates these two pictures is the color, the shape, the size, and by learning by itself how to differentiate them, then you don't need all the scientists to feed the machine all these parameters and all these criteria. So this is pretty much how artificial intelligence creates intelligence. It is not so much intelligence as we see it as human. It is more the capacity of learning to do something and being able to replicate that task, either by learning by itself in the case of deep learning, or by sort of an assisted learning in the case of machine learning. So this is pretty much what we mean by intelligence in artificial intelligence.
I think I had a couple of eureka moments from our participants. It's great. I think we can move on to the next question. So we think that artificial intelligence is something very much of the future, right? At least that's how I see it. But when was the first usage of artificial intelligence in healthcare? Is it something of the future? Is it something of the past? Is it something of the present?
So it is something of quite a bit of the past. So the first time that we had the first sort of application of artificial intelligence in healthcare, it was in the 1970s. And at that time, we already had artificial intelligence for 15 years. So that brings us quite a while back. The first time that we actually used the word artificial intelligence, not specifically in healthcare, but just in general, was in, I think it was 1955, 1956. And it was at this Dartmouth College conference where a bunch of scientists gathered and they said, you know, I think that by now we have all the math and the statistics to understand how human neurons work. And now that we have that, maybe we can create artificial neurons. We can create artificial intelligence. And this is where the first idea of artificial intelligence emerged. They were way too ambitious, considering that today we only know, I think it's about 20 to 40% of how our brain works. In 1956, saying that they already knew how a neuron works and how they can replicate it with technology was a bit too pretentious. But anyway, this is where the word artificial intelligence comes from. So if you fast forward 15 years later, in the 1970s, you have the very first application of artificial intelligence in healthcare. And at that time, it was used to help scientists in identifying unknown organic molecules. So it was very specific to organic chemistry. I'm not sure that with what we call today artificial intelligence, back then we would have called that as well artificial intelligence. Maybe it's more of what Frederike just said, you know, statistical models and things like that, and not what we know today as being artificial intelligence. But the very early applications of artificial intelligence was to identify new molecules, to identify what are the different strains of bacteria and what treatment could be given for depending on the different strains of bacteria. So this was the context in which it was used. And it had nothing to do with the general public. It was very linked to the scientific and research world.
Excellent. So something a little bit of the past then, at least the first tryouts. And moving on to the next one. What are the most common examples of artificial intelligence that have a direct impact on patients' lives nowadays?
There are a lot of different examples of AI that have a direct impact on patients' life. If you take the patient journey, the healthcare journey, you pretty much have AI application at each step of the patient journey. I'll give you two examples that are those that are most used today and that are very interesting. The first one is linked to diagnosis. So you know today that when a doctor gives a diagnosis, usually it is based on three things. First of all, the data collected about the patient. This can be done through the clinical examination. It can be done through medical records, through history, through now we have wearables and apps and things like that. So this is the data collected about the patient. Then the second thing you have is the knowledge that the physician has from all the studies that he read, all the clinical trials that have been going on, etc., which feeds his reasoning. And then the third thing that you have is his experience, the way that he feels, the way that he interacts with the patient. And this is something that's more linked to our emotional intelligence and to our expertise and experience and things that we go through in life that guide physicians into giving a diagnosis. Out of these three things, artificial intelligence can help with the first two, meaning that artificial intelligence can make sense of a very large set of data, and from that very large set of data, pull out the insights and pull out the interesting information. So for instance, it can analyze all the patient's medical records, it can look at data from wearables, etc., and pull out what's the interesting information for the physician to make a decision. Then the second aspect is that unlike physicians, AI can actually go through all the medical literature. As a physician, you only have a certain amount of time in your day, and it is absolutely impossible to read and memorize all the medical literature out there. It is just not feasible. So now you have algorithms that can do that instead of you. And again, pull out from this literature everything that's interesting to your case. So with the support of AI, physicians now have access to really what's most important and the things that can really help them give the diagnosis. And then with all this data that is sort of given by the AI and with the physician experience and the relationship he built with the patient, then he can provide a diagnosis, and it can be much faster, much more accurate as well, and really based on the latest data that is out there, and that is sometimes very hard for physicians to really read all the time and understand and memorize, etc. So this is the example for diagnosis. The same goes, for instance, for robot-assisted surgery, where again, in making decisions throughout the surgery, you can be assisted as a surgeon by a robot that would help you do your surgery, and that also has a huge impact on patients because it will pretty much give you the path with less risk, with less complications, that will pretty much provide you the best outcomes. And you can do that yourself as a physician and a surgeon, but you can also be assisted by a technology that will guide you, it will not impose anything, but it can guide you, it can suggest other paths that you maybe are not aware of. So it's really, when it comes to helping patients, it is a relationship that has to be built between the AI, the doctor, and the patient for the benefit of the patient.
Thank you very much. And we will explore in one of the upcoming webinar more the relationship between healthcare professional and artificial intelligence, and what is also concerned to liability and others. So we will dive into this further. Next question, you, Anca. Which are the areas of healthcare? Which areas of healthcare will I develop into within the near future?
There are a bunch of them, but I'll give you one that I've been working on lately, and I think it's absolutely fascinating. It's mental health. So depending on the condition, it can take from days to months to years for a psychiatrist to actually diagnose a patient, because mental health conditions are sometimes very particular, they're very dependent on the environment, they're very dependent on the person itself. So it's very complicated sometimes to give a quick diagnosis. And one thing that we're looking at right now is the way technology can help speed up diagnosis in mental health. And the things that we realized is that there are two different things that technology can help us with. First of all is voice recognition. There are studies that show that there are over 16 different parameters that we can look at in our voice, and that will help us understand how a patient is feeling. And a human can only see or hear, I think it's around 4 or 5 different parameters. An algorithm can read all 60 of them. And so when you think about it, instead of spending this much time trying to understand how the patient feels and going through the history, etc., you can actually be helped by an algorithm that will say, so, I analyzed these 60 parameters and I think that it is X, Y, or Z condition. And then the physician can look at that and based again on his experience and what he knows of the patient can say, yeah, I think the algorithm is correct, or no, I don't think the algorithm is correct. But this is a major help that we can bring to psychiatrists. And the second thing also linked to mental health is facial recognition. And this is absolutely fascinating because algorithms can look at your face and see micro expressions of pain or stress or happiness. And so by analyzing the way that your face moves and all these micro expressions that we as humans perceive, but we're not absolutely conscious of what we're perceiving, then the algorithm can also give a diagnosis. And what's interesting is that all these tools can be available for patients at home. So they don't have necessarily to wait to go to visit a psychiatrist or any healthcare professional. They can use these tools at home to keep track of their mood, to keep track of how they're feeling, to have sort of this support, extra support from a machine in between visits or before going to see a healthcare professional. So it really kind of fills in the gaps that we have in the healthcare journey if we use this technology in a smart way and also medically controlled way.
So, and then we get to the juicy, a bit more complicated part of things. So for the moment, it is now like all thrill, but surely there are challenges. So what are the biggest challenges linked to the development of artificial intelligence technology?
I think that the biggest challenge of the technology is the human behind the technology. And this is particularly true in AI. Why? Simply because AI is, you can pretty much call that sort of a, stupid technology, where it does what it is taught to do. So if you teach it wrong, then it will do wrong. And there's this expression in AI that we say, garbage in, garbage out, meaning that if you train the AI on poor quality data sets and if you teach the AI to do poor tasks, it will just replicate what you taught the AI. And so there's an example that has nothing to do with healthcare, but it's an interesting one. It's Amazon. Amazon Human Resources had a major problem with their recruitment. The reason is that they gave this AI algorithm a bunch of resumes from people that were already employed in Amazon and that were, overperforming. They were great employees, and they told pretty much the AI, help us recruit the same type of profiles because those people are absolutely great and we want all the same people. What happened is that the AI analyzed the resumes and identified the patterns and started recruiting. And what Amazon realized is that the AI did not recruit any women. Why? Because the resumes that were given to the AI, very few of them were resumes from women. And so the AI just simply replicated what it was taught to do. So all the biases that we have as humans are reproduced by the machine. And this is a challenge for the technology. The challenge is not the technology itself. The challenge is the human that is programming the technology. And I think that this is really the biggest obstacle today in AI, is the people behind it.
Yeah. So obviously, that's something that we have to look very closely to ensure, as Frederike was saying also before, that everyone's benefits equally and the challenges are equally spread as well. And this is actually where we're getting to with this next question. What are the challenges linked to society actually that you see for artificial intelligence?
Well, it's pretty similar to what I said about technology. It's the fact that a artificial intelligence, again, is quite a stupid machine, stupid technology, where it doesn't have the capacity of distinguishing between right and wrong. It simply replicates what it is told to do. And so if you take, for example, social media, because it is such a huge topic today in our societies, is the way that content on social media is moderated, the content that is pushed, the fact that sometimes when you look at some type of content, everything else that is fed to you is very similar. So it kind of prevents you from actually looking at anything new, opening up to new perspective, etc. The thing is that algorithms are trained to identify which contents are linked to what you are watching and what you like, and which one of these contents create the biggest engagement, so likes and comments, etc. But the AI is not trained to identify what the content says. If it's, religious content, political content, sexual content, etc. So the AI, based on what you're watching and on the videos that have the highest engagement, it will suggest to you other videos that are the same. And usually on social media, the content that performs the best is content that has, some sexual connotation, or that creates a scandal, or that, this type of content usually overperforms. And so it creates sort of this vicious circle where you, as a person navigating on social media, are constantly fed this type of content that are selected by an algorithm based, on criteria that are good for the company that's behind it, which is engagement and, content that is similar to what you like. So what's not, not good about it? But the thing is that you don't analyze the content itself, and you just provide people with this content that is likable, etc. So I think this is a really big challenge. It's the fact that artificial intelligence lacks emotional intelligence. And artificial intelligence is great at automating tasks, at identifying patterns, at providing you with information that would usually take you years, or if it's absolutely impossible for a human to gather. But it is not good at emotional intelligence. It is not good at being a human, and is not good at being emotionally intelligent. And I think this is really a challenge, is that sometimes we rely on artificial intelligence to do emotional intelligent tasks. And this is something that we should be avoiding.
Yeah, and then opens up all the ethics and moral dilemma on a lot of things. And leaving a little bit that aside and focusing more on what we think artificial intelligence in and what is concerning, what are the top 2 misconceptions concerning artificial intelligence that you discovered in your work?
The first one is that AI will take over humans. We always have this misconception that, if we give an AI too much information, it will be able to, grow into its own brain and start acting like a human. And I think that from everything that I said so far, you kind of understand that this is not something that's going to happen. There's this very funny model developed by a scientist, which gave an algorithm different type of ice cream names and linked to the flavor. And it said, so these are the names of the ice cream, these are the flavors. Please come up with new types of ice cream and new names for the ice cream that could potentially, be a huge success for customers. And the algorithm came up with absolutely disgusting ice cream. And so it's like a short funny anecdote, but what it shows you is that algorithms are good at predicting stuff and replicating stuff, but they're not good at understanding what humans feel and what humans like. And they don't know if, mixing, I don't know, chocolate with fish,
tomato, yeah,
it is absolutely disgusting, or if it's good. And this is something that is linked to human intelligence. And until we are able to provide these algorithms with a conscience, with emotions, and with the perception of one another and social links, then we won't be able to create algorithms that will replace humans and take over humanity. And honestly, I don't think we will ever be able to do that. Creating something that has a conscience, that has social relationships, and that has emotions, that is just, creating a baby. It's not creating a robot that will take over humanity. So I think that this is a huge misconception about AI, and I hope that at the end of this talk, that misconception will disappear. And the second misconception is that AI will replace doctors. Again, I feel like in the example that I've given, it's pretty obvious that AI is not here to replace doctors. We can think as, doctors and humans in general as people capable of doing a bunch of different things that are very transversal, that can, think of a bunch of different problems and think of solutions, and et cetera, can do a lot of different things. AIs are very bad at doing a lot of different things, but they are very good at doing very precise tasks with very known input and expected output. And so each time we humans don't have time or don't have the capacity to go deep into a subject and expect outcomes out of that, this is where AI can help. But the doctor-patient relationship is much more than digging through data to identify outcomes. And it's much more than reading thousands and thousands of studies to know what are the best treatments. The doctor-patient relationship is about a human relationship. And this is something that AI will never be able to replace.
Thank you, Anca. I think for the first misconception, we can definitely blame Hollywood for at least 20, 30 years. And we had a couple of comments of people saying, ask Terminator and, other Hollywood movies, obviously. So thank you for that. So why and how should patients be involved in the discussion around artificial intelligence?
I think that the conversation is much wider than just artificial intelligence. The question is why and how should patients be involved in digital innovation in healthcare? And if we even, zoom out, is why and how should patients be involved in their own care? And if you look at it this way, it's pretty obvious why patients should be involved in their own care. And artificial intelligence will be part of that care. So if patients are getting involved in their care, in the decisions that are made, in providing data and input for the doctor or the AI to make a decision, that it is pretty obvious that they will have everything to gain. And what we also see a lot is, well, we see them less now, but we used to see all these companies that were developing AI solutions that had no medical input and no input from patients. And what you end up doing is that you create an AI that is completely decorrelated from the actual practice, from what patients need, from what doctors need. And so you create a technology, but that is completely useless in practice. And so involving patients in digital innovation, and especially on discussions around AI, is actually helping them be more active in their care, because as I said, AI is involved at each step of the care. It is involved in prevention, it is involved in diagnosis, it is involved in treatment, it is involved with follow-up, it is involved everywhere. And so if you as a patient want to be helped, if you want to benefit from the outcomes of using these technologies, then you have to be involved in the discussions around it to make sure that they are created with your needs in mind. And this is very important, and the same applies to all technologies. You cannot, as a patient, expect to, be the end receiver of something. I think that this way of thinking, we've moved past it. Now the way that we think today is that patients are not just the end receivers, the people that are just, sitting there, lying back and waiting for care to be given. Patients are not this way anymore. Patients are much more involved. Patients want to understand, not all of them, but some of them want to be more involved. Some of them want to understand. And so some of them want also to make sure that if they have to download another app on their phone, it is going to be an app that will help them. And so being involved in the discussion, it also means that you defend your own interest. And as a patient, your interest is your health. And so defending your health in the way that these technologies are developed, it is extremely important. And I know that you guys are going to have a webinar about ethics and things like that, so I'm not going to talk about it. But of course, as we have seen, the way that AI acts depends on the people behind it. And so if you as a patient are the user of the AI, but you are not behind it, then it might reflect how other people think, who have different needs, different interests. So you have to also be behind the machine and not just the receiver of the care or that of anything that the machine produces. So I think this is really crucial in any type of innovation, and especially AI, which is so reflective of the people behind it.
Excellent, thank you very much. And we really hope that with this series webinar, with the different activities that we'll be doing throughout this year and the next one, our community will be really empowered to first understand what we are talking about around artificial intelligence, and then really play their legitimate role in co-creation of anything that is related to artificial intelligence and in general their actual care. With that question, we came to the end of this interview. Thank you so much, Anca, for being so clear and using very simple terms to explain something that is actually could be explained in a very complicated and ununderstandable way. So thank you so much for that. And now is really we have a few minutes to receive questions from the audience, from your listener. For you that are listening to us, and also invite Frederike to join back the panel to be able to answer a few questions. So I'm going to read some questions that we already received during the webinar. Please, I really invite the audience to type your question in the question panel that you have in GoToWebinar, or if you're not able to write your question, to click on the option there is a little nice design of a hand, just to click on there so you can request the floor. So, and I think we have a question that could be answered to you both, Frederike and Anca. I'm gonna try to read it aloud and to make to convey the message as best as I can. So the question is, personal connections and interaction with caregivers professional is a large factor in current care models, and is important for both people, patients, and the doctor as well. How can we ensure that the personal touch and social connection are lost with the increased use of artificial intelligence in the health space?
I have a response to this. I think it's a common misconception that AI replaces humans, but that's not necessarily the case. There are also systems sort of like that could assist in decision making. It doesn't necessarily have to be a replacement. And I also think, again, linking to what I said earlier at the beginning, I think the question is really, if you're looking at the interests of patients, like what is really in the interest of patients when it comes to care, and what is really in the interest of saving costs. And it's really important to take a very close look whether uses of AI are actually used to just cut labor costs, to make care cheaper, or whether this is really in the interest of patients. So I think basically the answer is it's up to us, because yeah.
And from the EPF perspective, is really also our role to make sure that this is met at European level, and the decisions are taken for the people, for the users and the people that co-create. Anca, do you want to add anything on this?
No, I think Frederike resumed it pretty well, and it's you know, everything we've talked about during my presentation. It's the fact that doctors and AI are very complementary, because AI can do stuff that doctors would struggle or would take way too much time to do, and so it's an extra help they can get to be more efficient, to be closer to their patient. Because when you have a doctor in front of you that spends time, you know, just typing on the computer and looking at the screen, this is that much time that he doesn't spend looking at the patient and talking to the patient. So if you have an artificial intelligence or any type of technology that can actually take away this sort of administrative burden out of the practice of medicine, then you have a doctor that is much more dedicated to the patient. And even in areas such as radiology, where you would think, you know, why do we need radiologists anymore? We have AI. Even in those fields of medicine, doctors will not be replaced, because that human touch, that emotional intelligence I was talking about, this is not something that can be recreated with math.
Thank you both. Now we have a more disease area specific question concerning rare diseases. How can we ensure rare diseases are picked up by healthcare algorithms working with probabilities? I think, Anca, this was referred to when we were explaining the machine learning and the fact that they, the more they see cases and similar data, the more they're able to pick up. And obviously with rare diseases, they have their peculiarities. There are not so many cases, and in some cases, it's very hard to nowadays to receive a diagnosis for something like that. Maybe Anca and then Frederike, if you want to comment on.
So I have sort of a mixed answer. The first thing is that it is true that for an AI to be very performant and efficient, it needs a lot of data, because this is simply how it learns. You have to show the algorithm a bunch of data, and then it will learn to replicate what you're showing. And so in rare diseases where you don't have that much data, it can be a huge challenge. And this is why there are not a lot of use cases of artificial intelligence in rare diseases. On the other hand, when you compare it to a human and to a doctor, the AI will necessarily look at more data and be able to read more and analyze more data than a physician as a human will ever be able to do. So I think that on one hand, it can help if it has access to sufficient data, but it's sort of an area where the way that the technology works is an obstacle to using it in rare diseases.
Yeah, and when talking to several doctors, they were saying to me at least that they could be helped in excluding everything else, and then really taking the time that, you know, this is not something that artificial intelligence can detect, so we can really focus on what it could be and digging deeper, so it could in any case accelerate a little bit the diagnosis in at least in some cases. Frederike, you wanted to say something? Oh, I'm afraid that I can't hear you.
1 year into the pandemic and we still don't know how to unmute.
And then we talk about artificial intelligence and complex machine learning. I know, all being there.
What I wanted to say, I think questions around data are really important. And I think that's why sort of when we talk about regulating AI, it's really closely linked to questions around data governance. And the way that laws currently work, you're very welcome always. Individuals are able to share their data with whomever they want, but they retain rights over them, no matter where the data sits and who processes the data. And I think that's something that's really important.
Thank you. Sorry, there are so many questions coming in. What are the main obstacles to the implementation of artificial intelligence, and what are the potential risks need to be considered from scientists and policymakers? If there is anything else that you wanted to add in comparison to the presentation that we did, maybe focusing on the obstacles to the implementation in hospitals or other setting cares in Europe.
I think there's been some really excellent research done by Data and Society in the US. So they put researchers into hospital and healthcare settings to research what implementing AI actually looks like in practice. And something that's overlooked, and I think also in regulatory discussions, we always talk about rules that should be in place before the technology is used. But what's often misunderstood is that it needs a continuous sort of monitoring. And I think the other one is, regardless of what the quote unquote, what an AI system does, it's important that the people who interact with the system are very aware of its limitations, its strengths and its weaknesses. So how results are interpreted is just as important as how the system works. And I think in terms of risks, the challenges is sort of AI systems add an additional level of complexity to situations that are already complex. And then the challenges we're seeing is it can be difficult to really recognize bias in decisions, and it's not trivial to technically mitigate these problems. and the same sort of in context where we really want to know why and how a certain decision has been made, this can be challenging. And I think this is sort of, yeah, those are obstacles that aren't trivial, that are quite challenging to resolve on a technical level as well.
Anca, you want to add something on this?
No, I think that was a perfect answer.
Excellent, very coordinated panel. We have actually the last question because we are already a few minutes over time and I don't want to take more of everyone's time. Just to close, what can patients and patients' organization in your perspective can do to really be involved in the process of artificial intelligence development from your perspective? Maybe first Anca and then Frederike.
So there are different things that patients can do. First of all, a lot of AI projects are run in partnership with patient advocacy groups and patient associations. So one of the first things as a patient that you can do is get in touch with these associations that will then perhaps involve you in one of the projects. So this is the first way you can do that. The second thing you can do is reach out to the startups or the companies that are developing these solutions themselves, and just explain the fact that you are interested in these solutions. And a lot of the small startups are really interested in having input from the actual users and those that will benefit from the technology. So I think this is something that can be really interesting. Now, you don't have to, you have to also be aware of the fact that this is quite a new way of doing things. So companies are not that used to having patients knock on the door. So it might take some time, but I think that the conversation is more and more open, and you can be involved by reaching out to the people that are developing the solutions. And then another way of being involved is also by providing feedback, whether it is through in social media or by using the solutions and providing feedback to the companies or talking about it to your medical team, etc. There are different ways you can be involved at different stages of development of the solution.
Yeah. And Frederike, maybe more on the policy dimension, European level.
That was a perfect answer. I obviously don't work in the healthcare sector, so I don't know about the details, but I can comment on sort of the broader society and policy level. I think we're seeing lots of, it's amazing when these efforts are being pushed by patient organizations, but we're also seeing very different deployments of AI, either sort of to reduce costs, to save money, to sort of with the sort of hope of employing less staff. And I think in these contexts, it's really important that patient organizations make sure that whatever AI is used for in healthcare, that it is in the genuine interest of patients and all patients, not just some at the expense of others. I think that's the main point. And I think what this takes is to be really, this isn't rocket science. It's it's a technical topic, but I think everybody can, there's so much literature around this. I think the importance is to be a good advocate for patients is really understanding what the technology can and what it can do and what the risks are and what it takes to mitigate them. Because while this is in the interest that risks are mitigated and that AI is only used for what it's genuinely useful, interests aren't always aligned. So I think that's really important to keep in mind.
Yeah, absolutely. And based on that, we also wanted to share that we have, as EPF, Knowledge Hub on our website that we'll send you some information on, that you can start already seeing how you can engage. And actually, exactly on this, our next encounter, our next webinar will be on EU legislation on artificial intelligence, which is a perfect way to engage as patients and patient organization on the topic, because within the legislative frameworks that they will come for a discussion. Obviously, there is a lot the patients and patient organization can do to make their voice heard. And with that, we will obviously let you know when the webinar will be, but we're taking a little bit of a summer break so everyone can relax and then recharge for a very dense September with a lot of knowledge. Voila, you see where our Knowledge Hub, the address of our Knowledge Hub on our website. And I think with this we can close our encounter. And thank you so much for joining. We saw a lot of questions coming in around the GDPR and the treatment of data. We dig into this topic already last year. We have several webinars on the matter, and we will share with you the whole webinar series on digital health in the follow-up email, so you can go back to those resources and look there. And if you have more questions, obviously you can always reach out to us, and we can decide to revamp a little bit the topic if there is a further need. Well, once again, thank you so much, Frederike and Anca. I'm really also happy that we had a whole female panel to talk about something that is so technical, and in many cases is all a male topic. So I'm really also really proud of that. I hope that everyone really enjoyed this webinar, and I remind you that this will be also available for the recording will be also available on our website for anyone that would like to access it. Once again, thank you so much for being with us today and for sharing all your knowledge and expertise, and I wish you all a fantastic day. Bye.
Thank you. Bye.
Thank you so much. Bye.